Yeah, I'm just mad that we just let our viewers know.
Is there anything I should be doing in system preferences? I'm wondering.
Hello, everybody. Thank you for joining us tonight. We are having some technical difficulties with getting Dr. Mayo on, but she is on the phone with me, so we should be able to hear her. She's still trying to work through some technical difficulties. So I see that you guys are joining. Please let me know where you are joining from. Say hello, and we will get this session started. Let's see who we have. Hi, Miss Pat. How are you tonight? Thank you so much for joining us tonight. Dr. Mayo.
Yes.
Hey guys, can you guys hear Dr. Mayo? If you can, please give me a thumbs up. Hey Rochelle, how you doing, sis? Can you guys hear Dr. Mayo? Let me know if you can hear her. Miss Pat, you can hear her? Did you hear Dr. Mayo say hello?
Hello.
Miss Pat, can you hear her? Can you hear me? Yes, ma'am. Okay. Did you hear Dr. Mayo? Thank you, guys. Thank you for joining us tonight. I have on the phone with me Dr. Mayo. I'm sorry, but she's having some technical difficulties tonight. I wanted you to see her gorgeous face. She said she had on her red lipstick for y'all tonight. But she's having some technical difficulties. So you guys will be able to hear her, and we will try to get her back on so that you can see her. So for those of you who don't know me, I'm Lena Lassiter. I have my MA in Human Services, counseling with a specialization in grief, trauma, PTSD, advanced grief recovery method specialist, a senior leader in corporate America, co-author and the founder and president of Forever Heal. And what do? We aim to assist those with broken hearts to end their pain and reclaim their lives forever. This is done several different ways. We do one-to-one grief recovery classes, group grief recovery classes. We can do these in person or virtually. And these classes are licensed by the Grief Recovery Method Institute. We also go into corporate America and we talk about the hidden costs of grief in the workplace. We also facilitate grief and trauma in the church. We do workshops for the church. And we have a counselor on our board who offer helping children with loss. So thank you guys for joining us tonight. We have Dr. Mayo joining me. Hi, Wendy. She's on the phone. She was having some technical difficulties. So anybody with a MacBook and she's trying to download this Chrome and it's not working, let us know what we could do. Maybe you can help us out. Hey, Wendy, thank you so much for joining us. So we're going to continue tonight talking about grief and hoarding. So you would be able to hear Dr. Mayo on the line tonight. So I am just excited about having Dr. Mayo on the line with us tonight because I met her years ago on the mission field in Brazil. And I tell you, I was so impressed just with her knowledge, her intelligence, and she was there helping pastors, letting them know about self-care and to take care of themselves. And I tell you, my connection with her was just a beautiful, authentic connection, and I never forgot her. And I also never forgot her message to the pastors, and also her encouraging me to, finish my educational, goals, and just so sweet and loving and caring and smart. So thank you, Dr. Mayo, for joining me tonight.
Well, it's my pleasure to join you, and I just apologize for having technical difficulties. I know psychology better than I know technology.
That is absolutely okay. So I want to introduce her to you. So for you guys who don't know her, and again, we will do this again so you can see her beautiful face. But let me formally introduce Dr. Mayo. So she's a member of Mount Airy Baptist Church in Washington, D.C. She's the director of the Christian Education Ministry, director of Pastoral Care and Counseling Center. She's a member, a church board member of Shalom Outreach. She's a past chair, Pastoral Care and Counseling Commission, for the National Capital Baptist Convention. She worked with churches who were interested in developing counseling ministries, conducting training and staff to their members. She's also an independent consultant and a trainer. So she provides training to international demand reductions, IDR services to the U.S. Department of State. She participated in panel meetings as a principal writer and developed the curriculum. And she also conducts training internationally, specifically in the area of substance abuse treatment for women. She provides psychological and addiction treatment services and supervision services. Former roles include director of psychology in a hospital setting and adjunct professor. She has an MAC, Master's Addictions Counselor. She's a PhD. She has her MA in counseling and her BS from Howard University. Woo! Dr. Mayo. She has several certificates of completion for specialized training to include substance abuse, public management, and Christian education. So Dr. Mayo, we're talking about hoarding tonight. So again, thank you so much for being here by the phone. I'm sorry about the technical difficulties that you're having, but I'm just so honored and grateful that you can join us tonight via telephone.
Well, it's my pleasure, and thank you for the invitation.
Thank you so much for being here tonight. So, Dr. Mayo, we've been talking about hoarding. Wendy said that's all. We have Wendy on here. She is a comedian, so she said that you were her cousin. Hi, Rosalind. Rosalind was also on the mission field with us. Hi, Minister Ross. So, Dr. Mayo, we have been talking about hoarding. So last week, what I shared with them is that hoarding is triggered by a traumatic loss or event. And the common contributors that I'm aware of, include divorce. It could be childhood poverty. It could be death of a loved one. And we also talked about how a loss is something or someone of value to individuals. So this is something that we treasure. So we talked a lot about that. So tonight, from a psychological perspective, I wanted to talk to you about hoarding and unresolved grief and how unresolved grief can manifest in hoarding behaviors and other behaviors, as a matter of fact. So thank you so much for being here with me tonight. I really appreciate you for joining us. Again, we have to get you back on to show your red lipstick. But thank you for joining us by telephone.
You're welcome.
So the first question that I have for you is hoarding a mental health disorder?
Yes, it is. I've been a psychologist for quite a while, and as people in the mental health field know, there is a manual, a diagnostic statistical manual that categorizes all the mental disorders. And many, many years ago, and I'd say at least 30 years ago, hoarding was not included. But in the latest manual, which is probably about 5 or 6 years old, hoarding is a separate category. And to become a separate category, there has to be a certain percentage of incidents, both in this country and really across the world. And people have increasingly been able to identify specific hoarding behaviors that cannot be attributed to any other mental illness. So it is its own separate category of mental illness. And there are particular treatments that we need to pay attention to because it is an illness that can be treated once it is recognized and persons are, encouraged to go into treatment.
Wow. Yeah, Miss Pat said that she didn't know that. She didn't know that. Yeah.
That it's a separate category.
Yes. So thank you.
Yes, it is.
Yeah. And Dr. Mayo, how does unresolved grief play a role in the hoarding behavior?
Well, unresolved grief, as you know well, is a process where there has been a loss, and it can be anything. It could be a death, a job, it could be age, it could be beauty, it could be anything that you lost. And when you grieve that loss, if you don't go through the stages of grief, then you try to figure out something else that either is going to give you what you think is the comfort that you're looking for, or somehow soothe you.
Yeah.
And sometimes it becomes a distraction. And when you think about it logically, you can't say that, for instance, collecting glass figurines is going to replace the loss of a person, but it's somehow psychologically, it's like the acquisition of other things. And so your focus becomes on the acquiring of other things so that you don't pay attention to what you're actually grieving.
Wow.
So it becomes a complicated process, but I think that mentally we try to replace what we lost, but not in a way that's necessarily healthy.
That's good, because one thing that I say a lot is that, and I share with my clients, Dr. Mayo, as well, we're taught how to acquire things. But, now I can say I think we have come a long way, in educating individuals on what to do when we lose things. But we're really not taught, even from a young age, how to lose things. So what you said to me was just so powerful, right? So they're holding on to these things as a means of comfort. Yeah. And I have had, clients, their family members say to me, well, it seems like mom or dad, they care more about these things than they do us. Not understanding that they're using the things as a means of comfort.
Right.
Yeah.
And I think that one of the things that is particularly important now, and I say now, meaning anywhere from about March of 2020 to present, we've been in a pandemic. And when you think about loss and grief, you can't ignore it. There's been so much loss and grief since last March up until now.
Yeah.
Even if you have not personally known someone who has passed from the virus, there's so many other losses that we all have experienced based on being in a pandemic.
Yeah.
Where we're not able to move about as we normally did. So we've lost our freedom. Some people have reacted in ways that have been very oppositional. Don't tell me I can't do this. Don't tell me I can't do that. But the other thing is that we've lost our sense of safety and security.
Wow.
Who you can be around. Yeah. And have we grieved those losses?
Wow.
And when you think about the behavior that became very publicized very early in the pandemic, where you couldn't find toilet tissue, when you couldn't find Lysol, why? People were hoarding it. Now, folks were cleaning their toilets before the pandemic.
Right.
But all of a sudden, they were buying everything they saw in sight.
That's so true.
Again, the loss of the security and the loss of feeling safe and the loss of feeling clean. So if you saw Lysol, then you tried to buy all that there was in the store.
Wow. the loss of feeling safe, y'all. Did y'all get that? And the loss of feeling clean, some things that we don't think about. Dr. Mayo, I know you can't see the comments. I'm going to read some to you. So again, guys, thank you all for joining us tonight. We had some technical difficulties, but you know what? God is still good, and we just going to push through. We have Dr. Mayo on the line. We will get her back because I want you guys to be able to see her beautiful face. I want to see her face. So we'll get her back. But she's here with us on the phone. So again, perseverance. We're just going to push through tonight. I'm glad that you guys can hear her. Dr. Mayo, so one comment from Wendy Lee, she said, additionally, we're not taught that it's okay to grieve.
You're absolutely right. You're absolutely right. I mean, if somebody said, has lost something, anything, we'll say, well, oh, it's going to be okay, baby. Or you'll get through it. Or they'll give you something that supposedly comforts you, but diminishes your feelings of loss.
Yeah.
And I think that when we are able to acknowledge that loss is a part of life, then we will deal with it better. But to try to sweep it under the rug, it doesn't go under the rug.
It doesn't go under the rug.
It won't stay there.
Right. Because it will manifest itself, right, doctor? I mean, in some form.
Test itself, and it will come out in these different behaviors. And another thing that I think that we may want to pay attention to, particularly with the COVID and other kinds of the repercussions that have come from the COVID, is that there's a sense of sadness. I mean, some people have lost a lot of people in addition to other things, as I said, your safety, your health, your cleanliness. People are fearful. And I think that we have to pay attention to the possibility of depression and increased anxiety.
Yes.
And when someone is depressed, we have to pay attention. If I say that I'm having a bad hair day, that's not depressed. But if I don't want to be bothered for weeks on end, then you should be concerned about the possibility of depression. And we need to see what kinds of behaviors a person is engaging in to deal with that depression.
Yeah.
And one of the concerns I think we need to be real concerned about, particularly with our elderly, in terms of people who may be up in age, who may live alone, who may feel that all their friends have passed on. Look at hoarding of medications.
Wow.
Has somebody been holding on to their medications with the thought that they may just one day decide to not be here anymore? Wow. We have to be aware of what's going on with people around us, within our families. And as you say, since we don't talk about loss, we have to start understanding that it's okay to talk about it and to pay attention to how our loved ones and friends are dealing with loss.
That's right. That's right. Rochelle said, wow, there goes my Bath and Body collection. This is good information because I honestly did not know this. So a lot of revelation, Dr. Mayo, has been given tonight. Wendy also said, as children and adults, we're not always given a safe place to express our loss.
That's right. That's right.
And Patricia said, yes, you are so right, doctor. And we have Minister Roz. She said, never thought of the loss of feeling safe. Very interesting. Dr. Jackie, thanks, Dr. Jackie, for joining us. She said, thank you, Dr. Mayo, for your words of wisdom. All of the losses have been serious and significant. Yes. Rochelle said, this is deep and important information. Great information being given. And Wendy says, I love this different perspective. All of this is totally new to me. So you guys see why I wanted her on here. So we're going to have her come back to see her face. But even just her voice is powerful, right? So you see why she left such an everlasting impression in my heart, in my mind. I just love this lady when I met her. And that's who she is. So I'm glad that you guys are seeing why I wanted her to be on here. A different perspective. and she's so authentic and real with it. So, and that's what I liked about her as well. So you're right. Even thinking about the medications, doctor, I have to say, I've heard and I've experienced it myself with some family members where, they have these boxes and boxes of medication. And, I can only speak for myself. For me, it's just like frustrating. Like, why do you have all these expired medications? Why are you holding on to all of this? So back to the whole hoarding piece of it. But I never thought about, Dr. Mayo, if they were perhaps depressed.
Right.
And using this as a way of, hey, maybe one day I'll just take this medication and just be done with this.
Absolutely.
Wow.
And the other thing we have to think about is that, people talk about we want to get back to normal. We're not going back to what we used to do. So the way that we lived before is forever gone.
Yeah.
And as one of your viewers pointed out, there are changes that we have to adjust to, and we have to acknowledge that some things are gone forever. And if we think about 9/11, there are things that we do now as a result of 9/11 that we never did before.
Mm-hmm.
You can't go in a government building without showing an ID.
Right.
That happened as a result of 9/11. So there are things that are going to be forever a part of our society going forward. And we have to grieve the things that are no longer going to be a part of our society.
Right.
And it's okay. But we have to accept them. We have to grieve them. We have to understand that they no longer are going to be a useful part of our existence. Yes, we were more comfortable then. Yes, they served a purpose then, but no longer. So the grief process affects every area of our lives. And we have to learn to talk about it and then learn to help people work through it.
Yes, that's the thing, right? Just having the conversations about it, and back to Wendy's point earlier, letting people feel safe, not being judgmental, as to what's going on. And especially when it comes to hoarding, right? People can be just extremely judgmental, and to start saying, well, these people are just, nasty, they're this, they're that, whatever, the case may be. But again, not understanding that they haven't really processed their grief. They haven't truly processed their loss.
Right.
So they're in this mental state of, like you said earlier, I'm just trying to find something that will bring me comfort because what I knew is no longer.
Right.
And we always say too, that grief can be triggered by a change, right? And a familiar pattern or behavior that we're just used to. So you are just taking it there tonight, and I'm excited. Dr. Jackie said elderly are hoarding and taking meds intentionally and sometimes unawareingly. Yeah. That's true. That's true, Dr. Jackie. Yeah. And Minister Ross says, yes, Dr. Mayo, I feel the same way, that we will never go back to the way things were. Yeah. Yes, Minister Ross. So we have to be okay with grieving that.
Exactly.
Yeah. Grieving those feelings and expressing, how we feel and not being ashamed of, expressing how we feel. Like, it's okay. I know you guys have questions, so bring them on. Start sending me your questions you have for Dr. Mayo. Dr. Mayo, I do have another question for you, though. So when it comes to this, the hoarding behavior, you have made us aware that it is a mental condition, a mental diagnosis. And maybe this, question is just too general, but why is it that, some people can go through a traumatic event, and I think most of us, pretty much can deal with it, in a healthy, in a healthy manner. But then you have others that go to this extreme of hoarding. Are there certain comorbidities or, that causes people to just hoard and just hold on to things, or is it just based on the individual?
Well, I think it's a combination. There can be comorbidities, but there also, we all cope with different things, differently. I mean, there are some of us who when we're anxious, we eat chocolate, and there's some people who, when they're anxious, they drink alcohol. And there's some people, when they're anxious, they go to sleep. So we all handle things differently. And very often there are some common characteristics that you may see in someone who may have a tendency to hoard. For instance, there may be some indecisiveness. Very often there are people who can't decide, well, I think I like, these paper towels, but I think these are going to be stronger. So let me get both because, I think I'm going to need them both. They may have a tendency to procrastinate. Well, I see that I've got, 17 rolls of paper towels, but I know that I'm going to need them. So let me just hold on to them until, I can see if my neighbor needs some. And what happens is that they just continue to hold on to things because they feel a sense of security and comfort.
Yeah.
And it also says, okay, this can maybe take a little bit away of my indecisiveness because I'll have everything that I need for whatever's coming up.
Yeah.
So, you'll see those kinds of behaviors, but also you have people who just have difficulty planning and organizing tasks. So they'll say, well, I'll take this and I'll keep this, but, if I don't need it later, I'll get rid of it. And then once they get attached to it, then it's hard to get rid of it.
Yeah.
So, we handle things differently. We also, as one of your callers mentioned, we've not been taught to talk about some things.
Yeah.
So if you've gone through a bad divorce, or you've lost a job, or you've lost a family member and you've not processed that, you've put on the face that everybody wants you to put on.
Mm-hmm.
Oh, how are you? And you say, oh, I'm fine. Well, then, so then what they're doing is that they're figuring out ways that they can feel fine when they really aren't.
Right.
Woo. And with some people, it's collecting things. It's well, at least I've got a room full of shoes. I mean, most of us, we probably have more shoes than we will ever wear. But we sometimes call it being fashionable. But sometimes when you look at it, you may be hoarding.
Uh-oh.
Most of us probably, now I'm talking about women, might have probably at least 10 pair of black shoes. Now, why do we need 10 pair of black shoes?
Uh-oh. Y'all know what? I think I might have some technical difficulties. I think she's stepping all on my toes now. And I'm, you know what? And I know when you come back on here, and Wendy would probably tell on me, doctor, but I do hoard toilet paper. I hoard paper products. I don't know what drives that behavior. I don't know. Growing up, we didn't have toiletries. I don't know. But when I tell you, I go to Sam's and I have toilet paper all around this house. So when the pandemic hit, I'll just say we were fine.
Well, now I was too. I'm doing okay. I got enough toilet tissue for a while. But what the other thing is, if anybody ever had a period of deprivation or had a time when they could not afford to do something, very often when you get that opportunity, when you've reached the point that you can go to Sam's and buy whatever you want, sometimes you may overbuy.
Yeah.
Because it was the time that you couldn't.
You couldn't do it. Yeah.
So, and I think that, there are behaviors that are kind of the precursors to hoarding, and you kind of stop yourself, okay, well, I've got 16 rolls of toilet paper downstairs. I don't really need to get 16 more, because you kind of have an awareness. A person who goes into excessive hoarding doesn't have that awareness.
Right. Yeah.
They've 16 rolls, but they saw a sale and thought, okay, well, then I'll just get these 16 more in case. Wow. And then there's another sale and I'll get those 16 more. So there's not an awareness of the inappropriateness of all of that.
I got you. Okay. I think we're good then, y'all. I think we're safe. So I want to get to some of the questions that we have. So Rochelle is asking, are there any self-help books on hoarding?
Not that I'm aware of, because it is a mental disorder. As I said, it's in the diagnostic manual, but there are underlying issues that contribute to it. So you would need to deal with the anxiety. You would need to deal with the depression. You need to deal with the loss and that is underlying it to address the behavior, because the emotions of anxiety and depression and stress are the motivators, but the behavior that you see is the hoarding.
Yeah.
So to just address the behavior would not address the problem.
That's good. That's good. Okay. We have Brian on here. Brian says, hello, Dr. Mayo. Do you have any advice for approaching a family member who is unwilling to open up about their mental health, but there are clear signs that help is needed because of behaviors like hoarding?
Well, I think that has to be a very gentle and tactful conversation, helping them to, kind of look at, why do you have 22 figurines? And if they can talk about it in a way that they're comfortable. Now, you're not attacking them. You're just asking them kind of in a matter-of-fact conversation, why do you have so many figurines? And if they can explain to you why, then they have justified their behavior. So you're going to have to help them to gradually see the damage. And the damage comes with the unsafety of the environment, the excess, the harm that can come from a cluttered environment. So it would be a gentle conversation. And then if the person is still not willing, at some point you're going to have to think about having someone to do an intervention.
Yeah. Yeah. Okay. That's good. Wendy said guilty. Let's see. Rochelle said, wow, this hit the nail on the head for me. I'm so glad I tuned in. Now she said, I got to, I guess, do some self-reevaluation. Thanks so much for this information. You're welcome, Rochelle. Thank you so much for joining us. Dr. Jackie says, Dr. Mayo, would you say it is also environmental, growing up in a place of lack of poverty?
Yes. Well, I think I said earlier, if there was a time of deprivation.
Yeah.
When you didn't have things, and when you got to the point of being able to have and to afford, sometimes you feel that, I don't ever want to go back to where I was. I don't ever want that to happen again.
Mm-hmm.
And find yourself accumulating to try to compensate for what you didn't have in the past. And at some point it may get out of control.
Yeah, I agree. They are on it. You know what? I thank you guys for being so supportive, still supporting us through, technical difficulties. I'm glad you can hear Dr. Mayo. You guys are very engaged tonight. This is the topic that you wanted. So I'm glad that you're able to get some education around this, some better understanding. Thank you for being so engaged and treating my guests with so much respect and making her feel welcome. Let's see. Chastity says, good evening. If you see someone that is going through depression and you see that they are starting to hoard, or starting to have hoarding habits, how should we approach them?
I want to know about, what's causing them to feel so sad. What's causing the depression? And try to help them to at least express it and see if they would be interested in talking with someone about it. Not in a condescending or a badgering way, but just in a kind and empathic way. I've noticed that you're feeling kind of sad and you've lately seemed like you not have interest in things. What's going on? But in a way that you would engage them and allow them to share what they're thinking and how they're feeling, so that you can at least get them to the point of identifying that there is a problem. And then you can direct them to someone to help them work through that. And again, if you work on the depression, you can deal with the hoarding later.
Right. Just having compassion, right, doctor, that they're going through, this mental challenge, I think helps. So that's good. That's really good. Dr. Mayo, for me, another question, and this is my last question. What advice would you give to family members, again, who are just frustrated with the individual who's hoarding? Because sometimes, it actually severs relationships. Sometimes the families are estranged. They give the individual an ultimatum, and they're just gone. And you see this, and it breaks my heart to see, families like torn apart because of the hoarding behaviors.
Well, first of all, we have to recognize that no one intentionally, on purpose, wants to live in filth and clutter. That's not what they want. This is something that they cannot control. So don't treat it like they're deliberately stacking up stuff to make you mad. Get your feelings out of it.
Yes.
Stop being so offended and understand that there's a pain that they're dealing with. Don't deal with the behavior, the hoarding. The hoarding is the behavior that they are manifesting based on some feelings that's not being attended to.
Yeah.
So getting mad and separating from them or not talking, I'm not going to talk to you until you clean up your house. Well, I can't. I can't clean up my house. I'm immobilized by my anxiety. I may not be able to articulate that to you, but if you're concerned enough that you see that they're in pain, try to get to the pain.
Yes. Ooh, I like that. Try to get to the pain, guys.
Yeah.
Yes, I love that. I love that. I love that. Thank you so much. That's helpful.
I think with mental illness, I think that we very often think that people are doing things on purpose.
Yeah.
And nobody, I can swear that nobody, I think, wants to be ill, wants to be mentally ill, wants to have whatever symptoms and stresses that they're experiencing. And for us to say, we just snap out of it. You'll be okay. Just snap out of it. The same thing we do with grief. Oh, it'll pass. No, it won't unless you work on it. And so we have to acknowledge mental illness as an illness and figure out how to help the person get the help that they need so that they can resolve the situation and they resolve the behaviors that come with it. It's just like we wouldn't tell somebody if they said they had diabetes, well, you just need to stop eating candy.
Right.
Well, they may need some medication too. They may need some other kind of dietary changes, and they need a medical doctor who's going to help them to monitor that. So if we're going to give our physical illnesses that kind of attention, we have to give our mental illnesses the same type of attention.
I agree. I wholeheartedly agree. Yeah, that's good. And Rochelle asked, what if you are scared to let go of the pain? Ooh, that one was kind of deep, Rochelle. Okay.
Well, you're probably afraid to get rid of it because you're afraid of what may replace it. We hold on to stuff because we're not sure what's on the other end. But as you know, in terms of, blessing, you don't get them if you don't open up your hands.
Right.
So you have to let go of something, even though it hurts. Because on the other side may be something that doesn't hurt.
Yes.
But you'll never know if you don't let it go.
Right. Right. And when that...
The other thing that I think that I would encourage people to do is help me understand the advantage of being in pain. And if you ask someone to help you understand why they're holding on to it, why do you like feeling sad? What does it do for you? What are the benefits?
Yeah.
And it helps people to think about, well, maybe I should let go of this. It's really not doing me any good. Right. But we hold on to what we're comfortable with.
We do. And I like how you frame that too, right? I mean, if our hands are closed, then we're
Mm-hmm.
not allowing anything else, to come in. So if it's full of
Okay.
that pain and that hurt and that anger or whatever else it is, you're not allowing room for love and forgiveness and
Right.
and healing. Um, that was profound. Thank you.
Well, the thing is, when you think about the scripture, though, when you think about Ecclesiastes, there's a season for everything.
Everything.
And so everything that's in our life may not supposed to be there forever.
Right.
So there's a season for everything. So as one of your callers talked about, we haven't taught people to talk about loss. We have to recognize that things are seasonal.
Yes.
And we've got to learn to go with the seasons. I mean, what do we look like in the winter, wrapping up in winter coats and boots and hats, and then deciding that because it's spring, I'm going to still wear my winter coat, hat, and boots?
Right.
That's not a good look.
Right.
Nor is it a good feel. But it shows you how you hold on to something that you got used to.
Mm-hmm.
So
that comfort, like you talked about earlier.
Yeah, we have to learn to let go of things.
Yeah.
It hurts, but there may be something better on the other side.
Right. There's healing on the other side, y'all. There's healing on the other side of that pain. That was a very brave question. Thank you, Rochelle, so much for asking that question. One thing I wanted to remind you guys of also, tonight, and again, something that we talked about on last week, Dr. Mayo, or 2 weeks ago, I'm sorry. What I said to them was, hoarding developed as a gradual problem, right? So to recovery will likely be a gradual process, just one step at a time for the individual who's hoarding. So let's make sure that we're practicing patience, with them. And like Dr. Mayo said, you're looking at the pain that they're in, right? Versus that condition. And, and saying that, oh my gosh, how can you live in this filth and live like this? But, try to recognize the pain that they're going through. And also, again, remember that this has been a gradual process, for them. So it's going to take one step at a time, to get them out of that, that situation. So let's try to make sure that we are very patient, loving, and compassionate towards, these individuals. Dr. Jackie said, there's healing on the other side. Amen. Yes, there is healing on the other side. Well, Dr. Mayo, I'm going to give you the floor for any last comments before we wrap it up tonight. We are going to have you back. We're going to have you back. So, guys, we're going to have her back. I'll let you know the date so that you can see, again, her beautiful face, because as you are aware, there's so many topics around, unresolved grief. Maybe we'll have her come back and talk about, grief, that our leaders endure, right? Pastors. So I would love to have her come back and maybe speak on that, or grief in the African American community. So Dr. Mayo, whatever you want to come and talk to us about unresolved grief, I would love to have you come back so that we can see your face. But I want you to know that even through you calling in tonight, it has been impactful. Everyone's been engaged, comments coming in left and right. So I really appreciate you being here tonight. So I'm just going to leave it open to you now. Any last words of wisdom for us who are watching live or watching the replay tonight?
Okay. Well, it's been my pleasure to be with you. And again, I apologize for my lack of technical skills that don't allow me to kind of quickly do things that I need to do. But I've enjoyed having the opportunity to share with you. But one thing I would like to point out is that hoarding, as you said, is not something that happens overnight. And we need to pay attention to behaviors in our children, possibly as young as 10 or 11 years old, where they start accumulating things and have difficulty separating with toys or separating from clothing. They may have outgrown something, but they still want to keep it. Or they have a toy that's broken and they want to keep holding on to it, and they accumulate them. And what you'll see is that the behavior starts as young as that, but we don't see it interfering with their functioning until probably about their 20s. And, this is after the time people have graduated from high school and they've maybe gone to college and they may be thinking about setting up a household, but they have accumulated so many things that you start seeing signs that it's interfering with their functioning. And so if it goes unaddressed, we see that the severity increases with age. So the most profound instances of hoarding are typically seen in people over 50 years old.
Mm-hmm.
And so I think that we can pay attention to some of the signs that we see when people are younger. And I think that goes for anything related to mental illness, though, is that we just have to be attentive to each other and to family and our environment and recognize things that could possibly be kind of nipped in the bud before it becomes a major issue. Yes. But again, I just want to point out it is a developmental illness that does start at a young age and progresses if not attended to.
Wow. That was informative as well, because I would have never even thought about children, right? The behavior starting, as early as 10 years old. So, whew. Well, you have a lot of thank yous. Thank you, Dr. Mayo, for your wisdom tonight. Minister Roz, she was on the mission field with us in Brazil. Tammy Edwards, thank you, Tammy, for joining. She said, very informative. Love this. Love you, Tammy. Thank you, Queen. Dr. Jackie said, we all met on the missions field in Brazil. Thank you, Dr. Mayo. Thank you, Minister Lena. Grateful for the connection. Thank you, Dr. Jackie. You keep pushing. You keep shining yourself, Dr. Jackie. Appreciate you. And Miss Pat, she is one of our faithful viewers, Dr. Mayo. She's here with me every time I'm on, and I'm so grateful. Thank you, Miss Pat. She says, Dr. Mayo, thank you so much for those wonderful nuggets. Love to have you back. So they want you to come back, Dr. Mayo.
Okay.
All right. Dr. Mayo, thank you so much. I love you so much. I cannot wait to have you come back. Just let me know what dates work for you. And we're going to get you back out here with your red lipstick on.
Actually, it's pink because I put on a pink dress.
So with her pink lipstick and her pink dress, y'all. So I really appreciate all of you guys for your support. Thank you for being engaged tonight, your questions, being very interactive. Remember, if you know someone who needs help with on this topic, they can visit compulsivehoarding.org. compulsivehoarding.org for more information. If you are struggling with hoarding as a result of grief, you can contact us, www.foreverheal.com, or you can call me at 804-684-1113. Thank you all for joining tonight. Please share, like this video. Dr. Mayo, one last question. Are you still practicing?
Just a little.
Okay.
I've retired a couple of times.
Okay.
I do some consulting right now, just, a few hours a week, but not a lot.
Okay. How can our viewers contact you if they want some consulting services?
Well, you can give them my email address.
Okay. I will post the email address, guys, to this video so that you will have it. As always, guys, I pray that you will have peaceful rest tonight, a peaceful week, and remember to walk in your healing. We love you and have a great evening. Good night.
Good night. Thank you.